Hey guys, today I am going to talk about L-Citrulline and its effect on erectile dysfunction. Erectile dysfunction or ED is a very common condition. In fact, it is reported that more than 50% of the men ages from 40 to 70 suffer from some form of erectile dysfunction. It can be poor erection, low libido, or lack of desire. The most common cause of erectile dysfunction is poor blood flow. It can be due to vascular diseases like hypertension, diabetes, or cardiovascular health, or in general poor health. The lack of blood flow causes poor erection, and I have discussed more in detail about the mechanism of ED in my L-Arginine video. The most important chemical in our body that helps improve blood flow is nitric oxide. Nitric oxide causes vasodilation, and by vasodilation it increases the blood flow to penis, thus giving you stronger, longer lasting erection. How does L-Citrulline improve the symptoms of erectile dysfunction? So L-Citrulline is an amino acid naturally produced in our body and is also found in certain food like watermelon. L-Citrulline indirectly increases the nitric oxide production in our body, which nitric oxide in turn improves the blood flow to penis, giving you a stronger erection. L-Arginine has a similar effect in our body, and I have talked about the importance of L-Arginine for ED. So watch my L-Arginine video. So L-Citrulline gets converted to L-Arginine in our kidney and produces more nitric oxide in our kidneys. Unlike L-Arginine, L-Citrulline bypasses the GI enzymes and liver enzyme, thus more bioavailability for the kidney and more nitric oxide production in the kidneys. So L-Citrulline has a similar effect like L-Arginine but is absorbed better from the GI and produces more nitric oxide in the kidneys. So L-Citrulline, an amino acid, is good for men suffering from mild symptoms of erectile dysfunction. Now if you are suffering from moderate to severe symptom of erectile dysfunction, there are excellent medication that I have talked about in the past called Cialis, Viagra, which is considered safe and effective for treating moderate to severe erectile dysfunction. But even when you are on this ED medication, when you take L-Citrulline, it gives you the synergetic improvement in the symptoms of erectile dysfunction and thus giving you stronger, longer lasting erection. So if you are suffering from erectile dysfunction, try to incorporate L-Citrulline in your daily supplement diet. 5 benefits of L-Citrulline. L-Citrulline may improve the symptoms of erectile dysfunction. It may improve cardiovascular health, lowers blood pressure and improves blood flow, boosts immunity, and enhances the brain function and cognition. Today we'll talk about L-Arginine and its effect on erectile dysfunction. L-Arginine is an amino acid that is produced in our body and is very commonly used supplement. L-Arginine can be used to improve the symptoms of erectile dysfunction because of its effect on blood flow and circulation. Erectile dysfunction is the common condition in which man has difficulty achieving the erection or maintaining the erection. There can be multiple causes or underlying causes for erectile dysfunction, but the common factor among all is the poor blood flow to penis. So when the penis is not getting enough blood flow, it will be very difficult to achieve proper erection or maintain it for longer time. L-Arginine is thought to improve the blood flow by increasing the nitric oxide production and by relaxing blood vessels. Some studies have shown that L-Arginine can help improve mild to moderate symptoms of erectile dysfunction. L-Arginine can also be taken with other traditional ED medication like Viagra and Cialis to improve the effectiveness of other ED medications. Before you do high dose of L-Arginine, make sure you talk to the medical provider because L-Arginine can drop your blood pressure. So if you have any blood pressure problem or heart problem, make sure you talk to your medical provider before starting high dose of L-Arginine. Here at MyFitMed, we do IV L-Arginine to improve the blood flow and circulation. Today's topic is, well, let's just say it's one that most guys might not talk about over the brunch. That's right. We are talking about boosting performance in the bedroom naturally with some powerhouse vitamins. Whether you are looking to impress or just want to feel like your best self, I have got the laydown on vitamins that can really make a difference down there. So let's get into it. Okay, let's get real. Erection are pretty complicated science, like a rocket science, but for your body. They rely on healthy blood flow, good hormone level, and good energy. You might be thinking, can vitamin really help? The simple answer is yes. Think of them as the ultimate support team for your body, cheering on your blood flow, energy, and giving hormone that little extra nudge. Let's dive into the dream team of vitamins. First up, vitamin D, also known as a sunshine vitamin. Low vitamin D has been linked to low testosterone level and lower blood flow, which affects your erection. Think of it this way: vitamin D is like that best friend who always drags you out of your house for some sun and fresh air. You will feel better, and turns out your body will thank you with better circulation and good hormone balance. But if you're not getting much sun, like in winter, or spend most of your time indoor working, then you can take a supplement of vitamin D. About 2000 to 5000 IU a day is a good starting point, but as always, check with your medical provider. Next up, we have the B vitamins. Think of them as a caffeine for your vitamin world. B vitamins, especially B3 and B12, are key for energy, stress relief, and blood flow. You know that pep in your step feeling. These vitamins are behind that feeling. Niacin or B3 is the rock star when it comes to supporting blood flow to all the areas, and I do mean all the areas, not just for the erection. In B12, it's there to keep you energized and stress-free, so eat your leafy green, whole grains, and meat, or grab some B complex supplement. Now let's talk about vitamin C. This isn't just for keeping you from getting sick or improving your immunity. It's also for improving your circulation. Good blood flow is key to stronger erection, and vitamin C gives that a boost by increasing the nitric oxide level. Think of nitric oxide as the VIP pass that makes blood vessels relax and open up. This helps blood flow where it needs to go. Grab some oranges, bell pepper, or take 500 mg of supplement daily if you need a little extra help. Now we are on to zinc. This mineral is like a personal trainer for your hormones, especially the testosterone. Low testosterone can mean low sex drive and poor performance, and zinc helps with testosterone production. And here is the cool fact: oysters are one of the best sources of zinc. Now we know why they are considered as aphrodisiac. Around 11 grams of zinc a day can give you that boost, but don't go overboard. Too much zinc can have an opposite effect, and no one wants that. And finally, let's give a round of applause to vitamin E, known as the sex vitamin. Tadanafil, known as Cialis, and Sildanafil, commonly called Viagra. We'll cover how each works, the best time to take them, potential side effects, and which one might be the best for you. So let's jump right in. Erectile dysfunction is when a man has a difficulty getting or maintaining an erection. It can affect men of all ages, but it's particularly prevalent among older men. According to research, about 52% of men aged 40 to 70 report experiencing some degree of ED. This issue can arise from various factors. Main three factors that leads to ED are physical factor. Conditions like diabetes, high blood pressure, heart disease, and obesity can affect blood flow and nerve function, ultimately leading to erectile dysfunction. The second is hormonal factor, particularly testosterone. Low testosterone level can contribute to erectile dysfunction. And number three is psychological factors. Stress, anxiety, and depression can impact your sexual performance. So understanding these causes is the first step in finding the right treatment. For many men, medications like Tadanafil and Sildanafil can be effective solution. Now let's talk about Tadanafil or Cialis. This medication is PDE5 inhibitor, which means it helps relaxes the blood vessel in penis, allowing for increased blood flow when you are sexually aroused. So let's see how it works. Tadanafil prevents the breakdown of substance called cGMP, which is essential for the smooth muscle relaxation in penis. When you are stimulated sexually, this increase in blood flow leads to a stronger erection. Now, how to take Cialis? Cialis or Tadanafil can be taken with or without food, which is convenient. The standard dose is usually 5 to 10 mg taken before sexual activity. But some men may take lower daily dose on regular basis if they plan to be intimate more frequently. When to take it? If you're taking it on an as needed basis, take it at least 30 minutes before sexual activity. However, one of the great advantages of Tadanafil is that its effect can last up to 36 hours, allowing for more spontaneity. Next, let's discuss Sildanafil, commonly known as Viagra. Like Tadanafil, Sildanafil also helps improve blood flow to the penis. How it works? Sildanafil works by blocking the same enzyme PDE5 that Tadanafil does, allowing for more blood flow when you are sexually aroused. How to take it? Sildanafil or Viagra can be taken with or without food, but it's best to avoid heavy or fatty meal as they can delay how quickly the medication works. The typical starting dose is 25 to 50 mg, taken about an hour before the sexual activity. When to take it? For the best result, take Viagra about 30 to 60 minutes prior to the sexual activity. However, its effect typically lasts around 4 to 6 hours, so it's more suitable for planned events. Now let's look at how effective these medications are. Both Tadanafil and Sildanafil has been shown to work well for many men. Let's compare the efficacy of both the medication. In clinical studies, about 81% of the men using Tadanafil reported improved erection, while around 74% of those using Sildanafil has similar positive experience. This number suggests that both medications can significantly enhance your sexual performance. The other difference can be patient satisfaction. Many men find both medication effective, but personal preference will play a huge role in which one to choose. Some may prefer Tadanafil for its longer duration, while the other might favor Sildanafil for its quicker onset. Like any medication, Tadanafil and Sildanafil comes with potential side effects. Here are some of the common ones for both the medication. Headaches. This is often due to increased blood flow. Number 2. Flushing. Some men may notice a warm feeling or redness in their face. Number 3. Indigestion. Stomach discomfort can also occur with these two medications. Number 4. Nasal congestion. Changes in blood flow can lead to stuffy nose, makes you feel stuffy. Serious side effects are rare but can include a prolonged erection known as peripresum, which requires immediate medical attention. If you experience an erection lasting more than 4 hours, seek help right away. It's crucial to be aware of drug interaction and safety consideration. When taking this medication, if you are on following medication, then please talk to your provider before starting ED medication. The first one is nitrates. If you are on medication for heart issue that contain nitrates, combining these nitrates with Tadanafil or Sildanafil can cause dangerously low blood pressure. This is a serious risk, so always inform your doctor about any medication you are taking. And the second one is alpha blockers. These are the medication that helps lower blood pressure. If you are taking them alongside Tadanafil or Sildanafil, you may need to monitor closely for blood pressure changes. To get the best result from Tadanafil and Sildanafil, keep these tips in mind. Number 1. Consult your doctor. Talk to your healthcare provider to figure out which medication and dosage is best for you. They can consider your health history and any other medication you may be taking. Number 2. Timing. For Tadanafil, you can take it about 30 minutes before sexual activity or opt for a daily low dose option for regular use. For Sildanafil, take it 30 to 60 minutes before you want to be intimate. Number 3. Healthy lifestyle choices. Eating well, staying active, and getting enough sleep can improve your overall sexual health and effectiveness of this medication. Number 4. Moderation in alcohol consumption. While a drink here or there may not hurt, excessive drinking can impair your ability to achieve an erection. So moderation is the key. Now let's address the common question. Which medication is the best choice for you? If you prefer medication that lasts longer, Tadanafil might be your best bet. With the effect that can last up to 36 hours, you can enjoy more flexibility in your intimate moments. If you want something that works quickly for planned encounter, then Sildanafil may be the more suitable with effects lasting around 4 to 6 hours. Ultimately, the best choice depends on your individual preference, lifestyle, and health status. Consulting with your healthcare provider can help you make the right decision. In summary, both Tadanafil and Sildanafil are effective treatment for erectile dysfunction. They work by increasing blood flow to the penis, make it easier to get an erection when sexually stimulated. Tadanafil offers a longer duration of action, while Sildanafil acts faster but with a shorter window of effectiveness. It is important to talk to your healthcare provider to determine which option suits you best based on your lifestyle and medical history. And remember, both medication requires prescription, so don't hesitate to seek professional advice. Thank you for joining us today to learn about Tadanafil and Sildanafil for erectile dysfunction. If you found this video helpful, please give it a thumbs up and subscribe for more information on men's health topic. If you have any question or want to share any personal experience, drop them in the comment below. We would love to hear from you and see you in the next video.